All right, everybody. Today you're going to learn about the Siemens Clinitek Status urinalysis point of care device. This is a very common urinalysis semi-automated instrument that you will see in many labs, doctors' offices, so on and so forth. Y'all are going to be using this device for the rest of the term. It is a very straightforward, very easy to use, very user-friendly device all around. Now, just to cover some parts of it, you'll see that it's an all-in-one instrument all by itself. It has a built-in screen where you'll do all the test ordering as well as look at the results. The way this machine works is once you've actually applied the urine specimen to the dipstick, it has this little tray that comes in and out of the instrument that you will actually align the strip onto when you're ready to use it. Now, this little turntable also can come off because aside from doing urinalysis dipsticks, it can also run specialized pregnancy tests that are made by the manufacturer. Now, you can't put any kind of test on here, but the ones that are made by the same manufacturer, you can run those as well. And basically, it's as simple as turning the table around, so that way it's prepared to use that for the HCG test for pregnancy or for the urine dipstick tests. Now, on the screen, you have a number of different options. From these options, you have your instrument setup, you have your recall results, strip test, as well as the cassette test. This is going to be your home screen when you see these four buttons. Now, for the sake of our class, we're only going to be using the strip test. Now, when I push this button, it's going to take us through a series of prompts and windows. The first one's going to ask for your operator name. I'm going to hit the button and type in my name. Once I've typed in the name, I'm going to go ahead and hit enter. And then it's going to give you one of two options. You can either recall patient or test new patient. This is a nice, easy way in case there's something wrong with the patient sample or there is an error, something happens, you just need to double check or troubleshoot. But if this is a patient that you've already put into the system, you can go ahead and just recall the patient as is. So if I go ahead and hit recall patient, it'll bring up the list of all the patients I've done in the past up until a certain point. If I want to enter a new patient, I'll go ahead and hit new patient. It'll ask me for the patient's name. So let's just go ahead and call this patient test. I'm going to hit enter. It's going to then ask me for the patient ID. Now, generally, this is where you would put the patient's MRN or lab ID number. Now, it has this alpha keyboard right here, but here in the corner, it lets you actually type in numbers. So if I hit that, it'll bring up a number pad. So let's just say for the sake of today, we're going to call this patient's ID 001. Now, at this point, it's going to ask you to prepare for the test. You see here on the side, it has two buttons, help and start. Once you hit start, the machine will give you exactly 8 seconds to prepare the sample before it actually starts running the analysis. So you always want to make sure you have that ready to go before it actually starts. And just for the sake of showing you, once I've hit the start button, it's going to ask me to perform the dip test on the instrument, remove the excess, blot, and what it will do is it'll start getting ready to process, where it'll pull the turntable in and it'll start processing it. Now, this one immediately stopped because there is obviously not an actual test strip on there, but just for the sake of showing you.